Okay, thank you. Hi, I'm Jennifer Broud, and I am here to introduce Dr. Laura Dixon. Dr. Laura Dixon is a clinical psychologist and associate professor in the Department of Psychology at the University of Mississippi. She teaches undergraduate and graduate courses, trains graduate students in the clinical psychology doctoral program, and directs the health and anxiety research and treatment lab. Her research incorporates diverse methodological approaches to systematically identify and evaluate cognitive, behavioral, emotional, and psychophysiological processes that contribute to distress and impairment in those suffering with misophonia, anxiety disorders, and related conditions. A primary goal of this work is to identify modifiable factors that can be targeted in psychological treatments to improve well-being. She is also the editor of the Journal of Anxiety Disorder, an associate editor. And today she is presenting findings from two of her recent publications related to prevalence and awareness of misophonia. Please welcome Dr. Laura Dixon.
Thank you so much for that introduction. All right, thank you so much again for that introduction, and to all the organizers and everyone who's participating today. I'm honored to be here and to be able to talk about the research that we've conducted. And I will do my best today to reduce triggers, but please feel free to mute me or turn the visual off. So, already done a little bit of background as to who I am. I'm in Mississippi. I'm a clinical psychologist and associate professor, and I direct the Heart Lab. In terms of my connection to misophonia, I started research on misophonia in 2018, and today I'm going to be talking about some of our work that was funded by the Misophonia Research Fund in 2020. I was also very excited to be a part of the Misophonia Consensus Committee that worked to develop the definition in 2021, and then have been a part of recent and ongoing grants and projects to better understand misophonia and improve circumstances for those with misophonia. Clinically, I provide supervision and consultation for therapists who are treating individuals presenting with misophonia. So that's all to say that I've been thinking a lot about misophonia from both a research and clinical lens. And I'm thrilled to be here today and be part of these conversations. And I'm going to be talking today more about our findings examining misophonia in a nationally representative sample of US adults. And in particular, the big question for us was, what is the prevalence of misophonia in the United States? Big question for many other people too. This question is critical as it has important implications for public health, practice, and policy, which is a core aspect of epidemiological research, which focuses on understanding and addressing health challenges at the population level. Health statistics, such as how many people are affected by misophonia, are used to inform public health practice, policy, and the allocation of resources, which then can be used to improve the health and well-being of individuals. So this number is a really important starting point for public health. And this was missing in the literature when we started this work. Our previous studies provide us with important information, such as 8 to 12% of psychiatric patients experience misophonia symptoms, 35.5% of individuals with autism experience misophonia symptoms, 12 to 20% of college students. And these studies are helpful for understanding what misophonia looks like in specific settings or among certain individuals. However, these rates aren't generalizable to the general population and are associated with different forms of bias. So for instance, some of my research focuses on college samples, and while these findings contribute to the larger literature, this sample is a convenient sample and comprised of individuals who are in college, young, mostly female, and have other unique attributes that aren't representative of everyone in the United States. And similar limitations can be identified for the other samples. Consequently, these studies can only tell us so much and can't answer the question of how many people in the United States are affected by misophonia. In terms of population-based research, there are a few studies that have come out, and as we were working on our study, there were 2 studies that examined misophonia at a population level, including a study based in Ankara, Turkey, where researchers found that 12.8% of their sample met for misophonia, and then in Germany, where they found that 2.2 to 5.9% endorsed clinical levels of misophonia. And so to do population level research, it requires very resource intensive methodology, which is why we have so few of these studies. Yet we were able to do this through our grant with the MRF. I'm going to try not to get too into the weeds, but want to highlight a couple of aspects of our research approach. So this study was conducted through Knowledge Panel, which is an online panel comprised of randomly selected individuals identified using a list of all the known households, all the addresses that is maintained by the Postal Service. So one of the most important considerations in this research is random sampling, which means that each person in the United States has an equal chance of selection. And in particular, this has to include all ages, ethnic backgrounds, income levels, and so forth. And moreover, so the sample is recruited to represent the US population based on the latest census. To further reduce bias in this research, individuals, and this research was conducted online where a survey was distributed. Individuals who do not have internet access, which is about 30% of households, they're provided with a device and internet service so that they're able to participate in this research, which increases access and representation in this sample. Finally, a number of quality control measures are in place, such as individuals only receive 1 survey per week to reduce burden and the potential for inaccurate responding. So that's all to say these different aspects really means that we've got a really rigorous methodology to answer this question. And so our sample included 4,005 adults that had a mean age of 48 years. And these individuals are reflective of the 2021 US Census based on gender, race and ethnicity, census region, education, household income. So this sample is truly representative of the US population and represents the largest and most diverse sample to date to study this question. So as part of this study, individuals completed an online survey that included the misophonia questionnaire and the Amsterdam Misophonia scale. And so the first question that we examined in the full sample was sensitivity to misophonia sounds. And we found that 78.5% of individuals reported at least some sensitivity to at least one sound, with people endorsing some sensitivity to 3 sounds on average. And as you can see in the chart below, people eating was the most frequently endorsed sound, followed by repetitive tapping and throat sounds. And then, so to determine the rate of misophonia, we use cutoffs established in prior research for the Misophonia Severity Scale and the Amsterdam Misophonia Scale to identify individuals with clinically significant misophonia. We were trying to get at symptoms, distress, and impairment, and found that 4.6% of individuals met both these criteria. So approximately 1 in 20 individuals in the United States. This approach is also similar to the approach used in the German study, where they used 2 cutoffs and identified that 2.2% of their population met for misophonia. As the next step, we wanted to know more about the individuals with misophonia and found that about half the individuals were female. And I think one notable area where these findings expand the research is that we have a representative sample, and we see greater representation in our individuals with misophonia in terms of race and ethnicity. So 62.4 identify as white, but over 1/3 of the sample identifying from another group. And then our mean age was 40. However, the largest age group was individuals between 25 and 34 years old. Education was fairly distributed across groups, and then in terms of marital status, most individuals were either never married or married. And for employment, most individuals were either not working or working full-time. And then I don't have it on here, but household income was relatively distributed from individuals reporting less than 10,000 per year to individuals reporting a household income of over 150,000 per year, suggesting that misophonia similarly affects individuals from all income brackets. We also looked at sensitivity to misophonia sounds specifically in the misophonia group. So individuals reported 5 sounds on average. And you can see in this graph, the dark blue bar represents individuals with misophonia and the light blue individuals in the full sample. And you can see similar trends, but of course, individuals with misophonia endorsing higher frequency of sensitivity to each of these sounds. We also gathered some information about misophonia history and found that most individuals reported their misophonia onset between the ages of 6 and 25 years old. The first sound trigger was often people eating, and most of the sample reported that their sound triggers have not changed or have increased in number and intensity over time. About a quarter of the sample reported they had a family member with misophonia, but over half the sample did not know if they had a family member with misophonia. Finally, we examined impairment due to misophonia and found that nearly 70% reported they experienced definite impairment in at least one area of life, with the most common area being social activities, followed by home management, work, relationships, and private leisure activities. So altogether, viewing all these findings, I think some of the key takeaways of this study are that sensitivity to misophonia sounds is common. About 4 in 5 individuals experience some level of sound sensitivity. However, most people don't experience the associated distress and impairment, and our findings indicate that approximately 1 in 20 US adults have misophonia. In addition, misophonia typically onsets early and is chronic and impairing. So this equips us with knowledge that's necessary for informing the identification, prevention, and treatment of misophonia. However, we still need additional work in this area to continue to refine this picture of the prevalence of misophonia in the United States, as well as other countries. So those are the big questions that we had. However, there were some additional questions that we were eager to answer in this nationally representative sample, including what's the role of emotion regulation in misophonia symptoms, and how many people have heard of misophonia. And I'm going to go through this data a little bit more quickly in the interest of time. So emotion regulation is how someone experiences, processes, and responds to emotions. Several studies have linked emotion dysregulation to misophonia, and we have extensive research identifying emotion regulation in the development and maintenance of other disorders. Importantly, it can also be modified to reduce distress and improve well-being. So the goal of this study was to evaluate emotion dysregulation in a large, nationally representative sample to inform our understanding of factors underlying misophonia and the development of treatments. So in this study, we first examined emotion regulation differences between individuals with misophonia compared to individuals with subclinical levels of misophonia. And so our misophonia group was individuals that we identified in our previous study, and the subclinical group included individuals who met below the cutoff. In these graphs, the dark blue bars represent individuals with clinical levels of misophonia, and the light blue is individuals with subclinical levels. Higher scores indicate greater dysregulation, so greater difficulties responding to emotions. And as you can see, individuals with clinical levels of misophonia reported significantly greater difficulties with general emotion dysregulation and difficulties with specific aspects of emotion dysregulation, including lack of emotional clarity, difficulty engaging in goal-directed behaviors and controlling emotions when distressed, difficulties accessing emotion regulation strategies, and difficulties accepting emotional responses. Beyond examining group differences, we also wanted to know, is emotion dysregulation, is it uniquely associated with misophonia symptoms, even after we account for demographic factors and stress, which are known to be connected to misophonia? So is there something else that emotion dysregulation contributes to this? And in short, we found that yes, emotion dysregulation and some of the specific subscales are uniquely associated with misophonia, which suggests that emotion dysregulation may be an important factor driving misophonia symptom severity. So our key takeaway here is emotion dysregulation is important in misophonia and should be considered in future research, including treatment studies. And finally, the last study that I'm going to talk about today is our study looking at awareness of misophonia in the US. So again, thinking of this national sample and what are critical questions that could advance misophonia research in a meaningful way. One piece that we were really interested in understanding is, do people know what misophonia is? So there's extensive research on public awareness in mental health disorders, and this research shows that greater public awareness is associated with increased likelihood of disclosure to others. It facilitates help-seeking behaviors, improves support and acceptance, enhances treatment options, predicts treatment utilization, and decreases stigma and prejudice. And from the chat today, too, this sentiment is also echoed from you all. And in the lived experience of misophonia, as individuals have identified, right, that knowing about misophonia and others in their life knowing about misophonia, it's helped their journey. So we investigated the level of misophonia awareness in this nationally representative sample of US adults. And specifically, the question we asked was, have you heard of the term misophonia? And found that when the survey was conducted in early 2022, 11.3%, or about 1 in 10 adults, had heard of misophonia. So some key takeaways from this, this helpful information that establishes a baseline for misophonia awareness in the United States. And it points to the need to increase awareness and spread accurate knowledge of misophonia. But of course, as we've seen today, and as you all are aware of and a part of, the emphasis on increasing misophonia awareness has been amazing and exciting to see all that unfold. And so finally, just want to acknowledge my team, who has been incredible in helping out with all this research, identified the citations from the work that I talked about today that goes into each of these findings in more depth. And yes, thank you to everyone.
Thank you so much, Dr. Dixon. That was a great presentation. And I'm just going to read out some of the questions for you. One of the first questions is from Christoph. My main triggers are eating sounds, including slurping but not swallowing, and shuffling noises from shoes not lifting the feet while walking. Can you explain how these triggers might be connected?
That's a good question. Gosh, you know, I'm trying to kind of think of research that kind of speaks to this, you know, and kind of the best way to answer this question. You know, I think when I think of generally the definition of misophonia, right, those are repetitive sounds and sounds made by humans, which are some of the most common sounds. In terms of why these and not others, I think the field's still answering those questions and kind of trying to learn about the development. So unfortunately, at this point, I don't think we have a great answer for that, but it's something really important that we do need to be thinking about and asking in our labs. So appreciate kind of pointing that out and bringing that up today.
Thank you. And a question from Zach Rosenthal. Why do you think that there are such high rates of prevalence often cited in the literature, but your study and the German study have lower rates?
Great question, and something, yeah, that we wrestle with. You know, I think with studies, when you're thinking about studies, you have to weigh the quality of methods and the type of sample that individuals are looking at. And this study was really rigorous in terms of making sure that we're trying to, as much as possible, reduce sampling bias that may inflate rates in a way that doesn't reflect things at a national level. And so, right there, when we're looking at other samples, such as college students or individuals who are presenting to clinics, we've got selection bias that might be coming in that we're seeing a different picture. We're not seeing kind of the full picture of individuals. And so I think that's one aspect. Both us and the German study used a kind of truly nationally representative, randomly selected sample. We also both used two criterion, and specifically two criterion that have been used a lot in the misophonia research, not perfect by any means, but have been validated and have been shown to be both identify true positives and kind of screen out true negatives, so that we're able to kind of get those people who really do have misophonia. And so we both used two criterion to kind of triangulate what we think maybe represents clinical levels of misophonia. And so that's another reason that I would guess that our percentages are similar. Happy to answer any follow-up questions with that one.
We've got about 1 minute left in this session.
Okay, thank you, Chris. For the lay people here, what is the significance of the prevalence? This is from Chris. In other words, how does the 5% compare to other more well-known conditions?
Mm-hmm. Yeah, so I mean, I think in terms of other well-known conditions, when I think of disorders like OCD and anxiety disorders, depending on the metric, you see that between 2 to 6% kind of in a year, individuals are diagnosed with some of these disorders. There's also lifetime prevalence. We didn't look at lifetime prevalence, and so that's having the disorder at any time in your life. And so when you look at any point in your life, those rates go up. But again, thinking about disorders that I study and kind of think about a lot, this is consistent. It's kind of a consistent percentage that, consistent with the range that we're seeing between 2 to 6% of individuals.
All right. Okay, we are at time. It looks like Dr. Brout has dropped off, but thank you so much, Dr. Dixon. This has been absolutely insightful, and I really appreciate you taking the time to share it with us. Thank you so much. Look forward to your future work as well.
Thank you so much. I appreciate it.